specialize on your diabetes。现在是最重要是我们的苦处在哪里？希望那个doctor跟你讲解一点他的平时的了解，跟那个小孩子怎么聊，我们怎样帮助那小孩子，怎么赞助什么什么。因为这一次来了，我们有2封信给你，一封就是常年的啦，一封就是说意思说可以请你们赞助。Diabetes Malaysia 呀 ，Diabetes Malaysia Miri District Branch。今年我们有2个任务啦，就是希望给你了解一下我们为什么给你谈这些 sponsorship of meters and strips 给这些医院的小孩子啦。麻烦你跟外地人讲一下你平时的工作跟这些接触小孩子他们需要怎么样检验检什么情形。
Okay. So Maya, I'm actually from the pediatric department in Miri Hospital. My special interest is actually in pediatric endocrinology. So which I see mainly the type 1 diabetes children. So actually in Miri we have quite a large population, I would say. The incidence of diabetes in children, they are not very well aware because children also can get type 1 diabetes, which means they actually have no insulin production at all. It's mainly antibody derived, so it will be a lifelong chronic illness. They will need support for the glucometer and also glucostrip. For now, actually in Malaysia, our pediatric fraternity has been trying hard to source the glucometer and strip for them. So for now, we actually have a 5-year program which we support glucometer and strip towards our children. But the 5-year program, actually this is our 3rd year already. So which means after the next 2 years, after the program ended from the central, we wouldn't have enough glucometer and strip for the newly diagnosed children. And sometimes the glucometer also will have problems, so they will need to replace as well. Mainly, I think Diabetic Association in Miri branch, they not only support children, they actually support adults as well with a type 2 type of diabetes, which means it's more of what we call adult type diabetes. Because of obesity and also the insulin resistance, you will see more and more people have a type 2 diabetes, which is mainly controlled by either taking medication or they have insulin. For type 1 diabetes, usually they are insulin dependent, means they require insulin administration mainly 4 times a day. So these children, for now, we have a pediatric endocrinologist from Kuching, which is doing visiting to Miri almost every 3 to 4 months. She covers Sibu, Bitu, as well as other small districts in Sarawak.
And then now what categories is the pregnant woman?
Yeah, so I think now more and more the pregnant lady also have a problem with gestational diabetes mellitus, so which means they get a diabetes during their pregnancy. Hopefully a lot of them will recover after the pregnancy ended, but some of them do require more support because we know in Malaysia itself, one need to go Batunia. I have a 10-year-old with 80 kilo, and I think in the 5 to 10 years to come, I would see them getting into 100 kilo. It's quite sure, Maya. So I think from the hospital side, we are trying very hard to raise awareness regarding diabetes in children, regardless what type of diabetes they have, but mainly something that we can control is type 2 diabetes, which means these children are actually obese to begin with, and they subsequently develop complications include the adult type diabetes. For type 1, nothing much we can do because the causes are not very well known. Sometimes the infection triggers the antibody and these children get the type 1 diabetes. But we know that if the children get type 1 diabetes, it expanded into their adulthood. So they will end up being a part of the community that live with type 1 diabetes. And so we actually have a diabetic camp for our type 1 diabetic kid to empower them so that even though their doctors change all the time, but they are get to support themselves by having good diabetic control. Because we know if their lifelong disease is almost 10 to 20 years, they are more likely to get complications, including hypertension, the high cholesterol, and most important thing is the kidney disease. Because if you once get kidney disease and you needed dialysis, one patient will cost the government at least 500,000 at least. because they come for dialysis 3 to 4 times a week.
So for various information, the youngest used to be 1 month old.
We
Now
have the
is
youngest.
1 year plus
Yeah,
already.
because of
So
the
now to
genetic
1 year plus.
disease.
1个月出世了，现在我长这个
born with a disease.
Yeah.
Yeah, because of a genetic abnormality the baby has.
So the children one, type 1 is basically also genetic.
Type 1 diabetes mellitus, some of them are
sometimes.
antibody.
Yeah.
This specific 1-month-old is a genetic disease. He has an abnormal gene that associated with type 1 PF, what we call a neonatal type of diabetes. But fortunately, this boy actually responded well with medication and also 1 dose of insulin per day. But we know that once they get so young, their development is not great. For this child, actually, he has a developmental delay whereby we see him is not as a 1-year-old now. He's almost 1 year plus now.
Okay. The thing here is all this. I see that it's quite costly as well. How is the government side on this? I mean, government has no budget or program for this.
I think for adult, no program. Very sadly to say, I think for adult, they don't have a program to supply glucometer. So it's mainly done by the district diabetic branch of Miri that they support the glucometer.
Now it's say a patient of diabetic patient requiring this glucometer or whatever. So government is not supporting.
For adult, not really. For children, we work very hard for the past, I think almost 1 decade. We managed to get 1 drug company to sponsor, but that program is only for 5 years. Which means once we pass the 5 year, the newly diagnosed children will not get to benefit from the program because it only lasts for 5
But
years.
for the past 10 years, we did apply from Dr. Street. He did give us something, but within these 2 years, still, because getting more and more patients, you see, not enough. So we have to look for this one, this one.
The alternative.
So the meters we are
I
using
think
is
the long-term solution to this is actually to get the health ministry to look into this. I mean, the private sector, being private sector, I think there's difficulty of long-term commitment and all that.
So,
Yeah, I think for this one, I think the health minister, fortunately here in Miri now, we have an adult diabetic doctor. She couldn't able to come today.
supposed to come.
Yeah, I think with the doctor around, they are able to actually push more support. But I think the Madam Ting aim is to settle the current problem, which means for now there is no support yet from the health ministry. It will take some time before we have budget to actually buy glucometer. In fact, last time the glucometer and strip for the children, some of them I get it from Madam Ting, some I actually have to source from outside, see whether they have donation and we bought from the pharmacy with the doctor's price. I bought one of the glucometer for one of my patients, but with the doctor's price then it's much cheaper lah.
太多了。
I will.
这里现在就maybe just look into it, see what's going on.
I will arrange
We also
something like
cannot.
I say, if you look at the problem in
这
the
个
long
对
term,
呀，这里
you have to get the government.
Yeah.
You cannot depend on
the
the private
government
sector.
one is when they go to consult doctor, they have their appointment. That moment is free of charge. But at home you have to do it yourself.
The glucose strip,
Not,
yeah.
not that every day you can go to the clinic and then the
Well, it depends how you look at it. It's just like medication. I mean, you have a disease, prescribe you the medication, you go back and you take the medication
yeah.
as prescribed, and this one is just some sort of gadget or instrument. What you need to do is, at home, you need to monitor yourself instead of coming to the hospital or clinic. I mean, if you want to look at it, actually, it's the same thing. One is in terms of medication that you consume. One is just some instrument or whatever that you need to monitor.
Yeah. This one is different. If you taking tablets or whatever medication is okay. But
So-
this one
so
you
need
have
to
to
do-
test it before you take the insulin. You have to test. Yeah,
4 to 5 times a
Yeah.
Same thing lah. I mean, you know, what I'm trying to say is, it is something that you can actually issue to the patient. It's train the patients how to do it themselves, and then take the medication themselves.
Yes, the medication mean,
I think medication for government are quite free for local.
because the
Medication, just
the
free.
insulin wasn't free.
The
So
sweet
that's the
not free,
tester, the Google tester only.
Tester, you can look at the tester like part of the management, you know. I mean,
Because realities Google Street are not supplied, unfortunately.
that's why I say it is just a switch of the mindset.
We suggest that the
That's
government
right,
hospital.
it is part and parcel of the treatment management. So this is the medication, this is the instrument, for measuring, your self monitoring.
So that don't say about these strips. Only also saying this take insulin also need needle. Maybe they don't supply also.
I mean,
Most of the time
that's why
doctors
I say
the government is not
the
supplying.
way to go is actually you must make the health ministry understand that this is part and parcel of the treatment. Yes.
No, we can't find it.
long-term planning.
long term, yeah. In
我们
long
自己
term
给我们
hopefully
也给不来，我们是给 alternative 班而已。alternative 班，除了他们自己
长远来
有
讲
买，
就是因为这个也是蛮贵的东西。
很贵的，很贵的。
你
我们用这个还好了哦，我们这个它是跟 Lancet Strips 跟我说一起来的，别个都没有哦，他们要 separate 买的哦。我们这个很好，我们买这个嘛，这个美国
这是
我们这个有right test，但一这个是活色的耶，
The whole set one.
我们这个它不，普通的
Yeah,
还
like
比
if the
较
government give my kids now, they don't have the alcohol swab. Quite sad. Yesterday I saw one of the kid came for appointment with his bag, with the glucometer I supply with the strip, and he's using the gauze that has been using a few times. I mean, as a doctor, I wouldn't think because I work in government sector. Insulin is free, but some patient really had difficulty even buying the alcohol swab. So I took from my clinic one, but they have to order, but it will be reflected into the budget. But I mean, for now, what I can do, I can do. But I think for a long run, I think they all are trying to supply post-adult that maybe they will need more help. I mean, for children now, for these 5 years, I have hopefully zero trouble. But the Diabetic Society is supporting my program for the type 1 kids for the power result.
And now another doctor one,
Yeah,
other
it's an adult,
adult
diabetic.
pregnant woman.
Yeah.
Is
They are separate, so they wouldn't have money to buy this all.
So she would like to meet you also, but unfortunately today
Today
she is
she's
in
in
Kuching.
Kuching, yeah.
So 这家 doctor 对 specialist, they are all specialists. So actually very lucky and Miriam, diabetes children or patients, and with all the specialists looking after them. So you try your best when we see what's going on. That is our problem now. This is our problem. So maybe we just check it see what's going on. Cannot say long term, in long term we just cannot, we only can help
We
to
hope
make
I think we hope the health ministry can look into it, but I think we are all very practical. In fact, I do ask for help from other places also to source fund. I had one HIV positive children that was from Batavia, and she is an Indonesian born to a Indonesian mother and a Malaysian father, but they are not married, so they are not considered as Malaysian. And she came to me at 1 year plus with a weight of 5 kg. Yeah. We do rejected them because they are foreigner. But I took in Navy. Fortunately, my nurses in Miri, I think Miriam are very great in heart. This is my second round in Miri. I'm actually from KL. I did my housemanship here. I went 1 year to Mambi. I served the district there for 1 year and I went back to pediatric training in HKL. So I completed there and I came back here to serve. Fortunately, my nurses went very hard to get them treatment for HIV. The drug 1 month is 2,000 for government for free, but the inpatient are not free. And she stayed with me for about 9 months, and her family got kicked out from the house in Batu Niah. Government wouldn't support them because these are their family problem, you know. But this reflected on my child general well-being. I mean, if I discharge her home, she got no home to go back to. I actually went to I seek for help from public. One of the Miriam responded and paid for their rental for that 2 months. So I managed to discharge her home. So a lot of time, I mean, yes, government is trying very hard, but the budget are just not enough, like Mayor said. It will never be enough. Yeah, but I mean, these are the things that really impact their well-being. If they have some support like from them, you know, give them the glucometer, then maybe they can try to source for their glucose strip every week, 4 to 5 times. Because we know once they check their blood glucose more frequent, they get a better control of what is happening. Yeah, instead of coming to me only check 1 week, 2 times, I couldn't do much thing. I can't adjust anything. I only got 2 reading. Yeah, so that's why I think they all are trying to get source for that. I had one diabetic kid came with a broken spec back in my days in Kuala Lumpur. One set of siblings, his sister got admitted in ICU and lost her arm. Because she was so ill, she was in ICU with medication to support her. I thought I lost her, but she survived with the brother. Both of them diagnosed same time, type 1 DM, diabetic. Mother was a drug abuse in KL, married 5 husbands, had another young kid now, always abscond. I couldn't find her in ICU. When he was well, he came one day with the broken glasses, and I asked, as a doctor, can I do anything more? But no, social worker couldn't help them. Budget don't have, government no budget to give you a new glasses. And I managed to call also from the public in KL, one of the spec shop. They sponsored him a new pair of glasses, and he went to school. And this year he's Form 1 in an Islamic school. So I think as a doctor, yes, government do give them free medication, but this sort of things really needed the public and the community to support them. Yeah.
I think specs, of course, is the one-off thing.
Yeah, spec is
But
one
these
thing.
these are, you know, this is long-term,
Yeah.
chronic, if you like, you know, I mean,
Yeah, but maybe not like a lot of support, Mayor, but if you can spare a bit of support for them, I think then they are working very hard to source also from other. We are also trying to empower the patient, say, okay, we give you this support, not that you depend on us for that support, but you need to, like, you know, we give you a bit of support, the rest you need to find. We need to empower you to do that. I hope that by this, because depending on the government is very far, we are very far from central. So what the doctors are trying to do is we try to empower the local community. Because I think Sawarakian person, people really gave a very big heart. They deserve good help from support, but unfortunately we are all from stay very long. Yeah.
thank you very much
Yeah.
for coming to have your service in Sarawak.
Yeah. I actually fell in love with Sarawakian people. The children are great, the patients are great.
Because of what I heard, generally all are very reluctant to come to Sarawak. That's why I was told that we are sort of 200 offices or something like that, I think.
Yeah. Mayor, yes, I mean, people need to start to open up, then only they are able to see the beauty of Sarawak.
True, especially Miriam. True. Especially the white is.
Correct. Yeah. I thought they already had a lot of support.
Try your best, see what's going on. That's why I made I say I cannot say anything on this medication. Better bring a doctor, try to explain something so that you know what's going on.
I'm Dr. Low,
Low.
LOH, yes. I'm in the children department. Yeah.
OK，这都
你慢一点还可以看到的得万高。
Yes, yes,
也是
yes.
这样看。
Yes, yes, yes. Her husband is taking care of our premature baby here in Mili.
哦，
Yeah. So
才来的，那个是很好运啊，你能够带你来，这已经来的，我们每个人抢救的，现在在我们面里，就跟我们谈的立刻做一次，很好，
这个我
不一样。